That's significant.
Nurses may be at the greatest danger. We don't doubt that.
But we care about,
so,
we care about
I know you care about everybody else.
Don't think we don't care about it. We care about our patients, we care about nurses, we care about doctors, we care about ancillary staff. But we're saying our big problem here, the big issue that we have, what brings us here, is that there is a misrepresentation to the public.
Yes.
And that is dishonest. This hospital has put out there that we have not been trained. This hospital has put out there that there have been drills, there have not been drills. We have presented, not just to you, because you're not in charge of the whole thing, which is why we came here. We did not go to HR. We came here because we needed to talk to the people who are making the statements. You didn't make the statements. We need to talk to the people who have the ability to make the changes. You didn't have the ability to do that. We're here to talk to the people who should be doing the right thing, and they're not. That's why we're here. And we think that the public should not be shammed and scammed the way they are being scammed by dishonesty, by total dishonesty. And we have a solution.
We have, they were doing a PPE simulation on Monday. We have 2 physicians in the ER, myself and 2 other nurses, and went over to ask them to find out, to inform ourselves. Obviously, we haven't been given any information, and I was told, why are you congregating here? Don't you have patients to take care of? I put myself out there, said I will come in, I will stay late, I'm willing to help, to work as a collaborative group to help protect everyone, staff, patients, everyone. And I was told, don't you have more important things to be doing?
Yeah, they do.
I'm sorry, I would be upset too if that happened to me. I wouldn't be as composed probably.
Well, who's that?
Pissed. Can I
Dr.
say
Weiss.
something?
Dr. Weiss? Dr. Weiss?
That is the.
What?
Maybe he'll come back. That was Dr. Weiss. Maybe he'll come back.
So he's letting Ben take the whole thing?
Yeah. Let me see.
So we're willing to sit down and meet with people who can make the changes right now?
This afternoon.
This afternoon?
This afternoon, we meet with Montefiore to go over our
We
demands.
need to do that
Presbyterian
today.
met with
Well,
us
look, I
with
mean-
12 hours notice.
Really?
Yep.
I'll tell you what we are doing. I'll tell you what we
It
are
should be
doing.
a
that I
top
consider.
priority.
The precautions to maximize safety are not a finished product. So one of the things that's being done, and I'm told within 48 hours it will be up, is a website here dedicated to Ebola that specifies what will be there, and it is updated as precautions are made more complete, more perfect. In addition to that, with respect to meetings, one of the things that I find is there are little scattered meetings all over, and they're not always with the infectious control people, with the ones that are supposed to know the most and have to choreograph all the things that are done to maximize safety. So we're trying to get, what is the most efficient way to reach the most number of nurses and other providers so that you're fully informed, up to date? And that's something we're going to be working on today. I'm supposed to be in sessions today to try and tell people at what stage we're in preparation, not what you would characterize as false or exaggeration or an outright lie, but rather, where are we concretely, how many have been trained, those kind of things.
Well, nobody.
Zero.
I talked to Dr. Curry. I don't know what to do with this because yesterday when I talked to Dr. Curry, I think it was last night, I asked him, how much training has there been? And he told me it was 100 and some people.
But
You know what?
they're
Training happens, then CDC or other experts decide that training is not the optimal training or ideal, so you retrain.
So
Excuse me, the fact is, there has been no training. So
Yeah.
internet is not training.
I think that's a lie. There may not have been training of some people, but some have been trained.
I work in the ER, there is no training at
Excuse me,
Wyoming.
do I have people from MedSurg here? Wait,
Yes,
right here. Do I have people from outpatient? Outpatient?
Yes.
I have people from the ER?
Yes.
I have people from pediatrics?
Who has been trained?
I have people who take care of people who are older. Home health.
I don't doubt that if someone says they haven't been trained, they haven't been.
Internet is not the way to train people.
No,
Printing something off is not a way
But
to
some people have been trained.
Our training has been. I want to talk to you.
One at a time.
Oh, okay, I now
Acronym names.
understand, you're
Yes.
telling me it's not training because it's not what training should include, is that? what you're
Exactly.
saying?
You,
Hands-on
wait,
training.
this is
Yeah.
a life,
Not paper, when
is
we
this a
have
life or
patients
death
to take
issue?
care of.
I would say yes, what would you say?
So when the firefighters are putting out a fire, right, that's a life or death issue, right?
Mhm.
Do you think that firefighters should have a PowerPoint to tell them how to put out a fire? My understanding, they go to radio and they set fires in buildings. This is a life-threatening illness that has killed more people than fires in a lot of places. And we want to have the training that
On
should be
hand.
going on. We think it should have been done. We are willing to move from
You
this
should have
moment,
dexterity
but
to
we
put
need to
put on
meet with
these
the people who are
Practice,
talking about
practice,
We need to
practice.
meet with them today to tell them what our concerns are and what we think we need.
There are two nurses here that could have already been infected with Ebola.
Yes.
That patient
Yes.
was around Ebola, two right here that could be spreading it.
And what we tell them, when they go home, to their family sick.
And we're not picking on you, we're not.
No, I don't take this
We just
personally, I
have
take
to-
this seriously.
We're
This is important.
That's why we're here, because our families are concerned, because our colleagues are concerned, because our coworkers are concerned, our neighbors are concerned.
The community is concerned.
And we are absolutely willing to care, it's not like we don't want to take care of these people, none of us want to close borders, none of us want to do this. What we want to do is make sure that we can take excellent care of people who are very sick and protect ourselves at the same time. We don't think the price of care should be our death.
Yeah.
So that's how we feel.
And Ben, if I could get a word, I just want to say, I think everybody here shares my sentiment. We all work for and with Montefiore, and we love Montefiore. We do want Montefiore to get the magnet status, to be the best hospital. This is what it requires. It requires us being prepared. It requires us making sure that if somebody does come to Montefiore that has Ebola, we've handled it well. And we can go out there, we can go to the press, we can go to our families, we can go everywhere and be advocates. We can be the people that say, this is the place. Right now, we can't say that, and that's really our concern. We can't say that right now. We're concerned for our families, for your family, for Dr. Safier's family. This is something that impacts all of us. If your frontline nurses are not trained and not prepared, that is a big problem.
That's right.
What they do, they get the paper and the internet is a training. That's not a training at all.
Are you practicing more stuff?
So,
Now I understand what you mean by that.
right, so
Now I
here's
understand.
our demand, and this is a demand now. Because we've been working for 2 months, we've got not what we need for 2 months. There's press out there that's saying we've been getting what we need. Today, we have a deadline. Today, we want to meet with somebody, or the people who are in charge of this program. We have people who are very willing to meet with them, who have